All right, today we are talking about a major global breakup. Seriously, the United States and the World Health Organization, well, they've officially called it quits. And the fallout from this could actually affect everything from how we stop the next pandemic to, you guessed it, your annual flu shot. Let's get into it.
So, there it is. It's official. As of today, the United States is no longer a member of the World Health Organization. This all came after a year-long process to withdraw. But as you're about to see, what official and final actually mean, well, that's at the very heart of this whole dispute.
Professor Lawrence Gostin just hit the nail on the head here. He called it a very, very public and messy divorce. And honestly, that is the perfect way to think about this whole situation. It is not a clean break. Nope, it's a super complicated split, and it involves money, legal fights, and shared responsibilities. So let's unpack both sides of this breakup. First up, let's look at the U.S. perspective. I mean, why did the administration decide that after decades of being a leader in global health, it was suddenly time to just walk away?
Okay, so the administration laid out a whole list of specific reasons. They argue that the WHO just completely mishandled the COVID-19 pandemic, and they're pointing to big delays in declaring it a global emergency. They also bring up a failure to make some urgently needed reforms, and they charge that the WHO couldn't stay independent from political pressure, especially from China. At the end of the day, there's this general feeling that the organization has just strayed too far from its original mission. The US is basically saying, hey, this partnership is broken and it's not working for us anymore.
But of course, in any divorce, there are always two sides to the story, right? So how did the WHO and the rest of the global health world respond to this? A former director of the CDC, Dr. Thomas Frieden, didn't mince words. He called it a grave error. And his logic is pretty simple. Health threats, viruses, they don't respect borders. The big fear here is that by leaving the WHO, the US isn't building some kind of protective wall. It's actually dismantling the global alarm system that warns us when a threat is coming. Now, this quote uses a really powerful analogy. Think of the WHO as a massive global library of disease data. You've got labs all over the world constantly submitting new information on viruses that are circulating. And the US? We used to have the best library card with full access to everything. Now, that card's been revoked. We're on the outside looking in. And here's the head of the WHO itself, Dr. Tedros, just putting it bluntly. He's calling it a lose-lose situation. His whole argument is that the world is less safe without the US involved, and at the same time, the US is less safe by trying to go it alone. It's a pretty stark assessment that this decision really hurts everyone. So what does this actually look like in the real world? This slide kind of breaks it down. When we were with the WHO, the US had a prime seat at the table, direct access to all those global disease networks, and a huge role in things like, designing the annual flu shot. Now, without the WHO, we could have massive blind spots to new threats, and we'll have to rely on this messy patchwork of individual agreements with other countries, which could be way, way slower. And now for the really messy part. Because like so many divorces, this one comes down to a big fight over legal status and money. And here is the number at the very center of that financial fight. According to the WHO, the United States owes $278 million in unpaid dues. And this is a huge deal because the US has always been the organization's single biggest financial contributor. So this gets us into the legal tug of war. The U.S. position is basically, hey, we're a sovereign nation, our decision is final, period. But the WHO is pointing back to the 1948 agreement that the U.S. signed, which says a member has to pay all its outstanding dues before it can leave. So the WHO's stance? Well, without that payment, this divorce isn't legally complete. And it's actually up to the other 193 members to decide if they even recognize the U.S. withdrawal. So with the lawyers fighting and the legal status kind of up in the air, what are the immediate real-world consequences? What happens right now? Of all the huge, complex global health programs out there, the most urgent and relatable concern for most of us is the annual flu shot. This is something that affects millions and millions of people every single year, and its development is now in a state of real uncertainty. So why is this such a big deal? Well, this timeline shows you the whole process. All year long, labs all over the planet are tracking flu strains and sharing that data through the WHO network. Then, And this is the crucial part. Every February, the WHO gets experts together, including, for decades, key scientists from the US CDC, to look at all that data and decide which strains to put in next season's vaccine. That one decision guides manufacturing for the entire world. And this leads us to the most urgent question of all. With that critical February meeting just weeks away, will the US even be there? Without our experts at the table, will the vaccine that we all get be as effective? The entire global health community is pretty much holding its breath, waiting for the administration's decision.
So what's the official plan B? Well, the U.S. strategy is pretty much to go it alone. The plan is to cut off all funding, pull all U.S. personnel who are working at the WHO, and instead try to manage global health threats through direct, one-on-one agreements with individual countries and by working with NGOs and faith-based groups. Officials have said the U.S. has plans in place, but so far they haven't really offered a lot of specifics. This quote right here really captures the core concern coming from the scientific community. When you're dealing with infectious diseases, global cooperation isn't just some nice political choice, it's a biological necessity. Germs don't care about our borders, and a lot of experts believe a coordinated global defense is the only way to effectively fight them. And that leaves us with this final, pretty sobering question. The world's single biggest contributor to global health is now forging its own path. After everything we've all been through and everything we learned from COVID-19, are we, the US, and the rest of the world truly ready for whatever comes next?